What makes a good doctor is a combination of clinical competence, so really knowing your field really well, and for a surgeon, good skills with your hands, and then also just having that compassion and care for the patient. You really need all three to be a good doctor. I've known since I was very young, I think maybe second grade, that I wanted to be a doctor because I wanted to help people. Really was interested in helping people, wanting to be able to serve my community, but I hadn't decided on surgery until I was already in medical school. I started training in general surgery, and I had a chance to see all the different surgical specialties, and really vascular sort of drew me to it because of the complexity of the patient diseases, the intricacy of the surgical work, and the variety. Most of my work is primarily geared towards taking care of people's arteries. So carotid endarterectomy for patients who have had strokes, aneurysm repair for patients that have aneurysms in their belly or in their legs, and then dialysis access for fistulas, as well as doing stents and other procedures to save people's legs who have arterial insufficiency in the legs. Most of my practice is really geared towards life and limb saving procedures for the arteries. Having patients' lives in my hands, I do take that responsibility very seriously. Before I'm doing surgery on somebody, I develop a good relationship with the patient and their families. That way that they can feel confident that I'll be ushering them through the surgical process and the recovery process with confidence. I tend to be, very problem-focused in my approach. I provide time for the patients to tell me their story. And for some patients, that maybe takes 30 seconds. Some patients, they need to tell me all the way back from what's been going on 5 years ago. So I try to be a very good active listener when they're telling me their story. And then, I'll ask questions that help us decide together what's going to be the best approach that's going to suit their lifestyle, their needs, and their disease process. I do get to have that long-term follow-up with my patients. So it's really rewarding to get to see them come back to me 6 months later, 2 years later, and I get to see how they're doing with the disease process, but we also get to check in on, the grandchild that was born or the wedding that they were able to go to and dance at because they still have their leg.